Now I will be passing it on to Jenn and Alma.
Well, hello everyone. Xin chào quý vị. Thank you for having us join today. My name is Jen when I am the program director for the Washington State Employee Assistance Program and also a proud member of Happen, um, another business resource group. We were just here today to share some information and actually have a little bit of an open discussion about mental health access and culturally relevant services. And my hope is that people will be interactive in the chat or come off mute and also answer the questions that they speak to you. Because the thought of talking at you for an hour straight, me and Alma are probably, I know I can speak for myself. I can't stand the sound of my own voice. So the thought of just speaking for an hour straight is horrifying. So I really appreciate the ability to be interactive and to hear from multiple different stories and multiple different experiences. And we find that this topic, is somewhat loaded. Speaking from my own experience, mental health access in the Vietnamese American community, Vietnamese community, is not something that was readily available or even often accessible. The term therapy in itself, there isn't a direct translation in our language. We kind of describe what it is and just say as one of the words, and it means like to share, but it doesn't really speak to the breadth and the depth of what it means to have robust mental health services embedded into our community. And so we wanted to bring a little bit of that conversation in today's session. So what I'm going to do is bore you for a promise. I've mastered this presentation down to 10 minutes, which is our EAP orientation. And all of this information is available for public use. And so I'm really just going to be queuing into the highlights. Um, of what EAP services have available to state employees and your families because um, much to what was said earlier, and I really appreciate the shout out. It is a wonderful resource. And I always said that it's because we live in a country where mental health services is tied, or just health services in general are tied to employment. I always said that when harm or trauma is experienced in the workplace, it's the organization's responsibility to provide those resources for processing and healing. And I am grateful to be part of a very robust resource that's available to folks. And so without further ado, I'm just going to queue up our presentation really quickly, flip through the side. Please know that none of this is intended to be like absorbed all at one time because it's a lot of information. And so all of the slide decks in our orientations are available all online for free. And if you ever want any one of us to come into your teams, like if you have all staffs or smaller team discussions and want to disseminate and share the information out, or even host any of our webinars around wellness or self-care or burnout prevention, any of that, that's all available to you as well. So I'm just going to jump right in and then kick it over to Alma. But before I start the slide deck, I wanted to have my DES fellows introduce themselves. So Alma, and I saw Masozi join too. Alma, can you hear me? Can you want to just introduce yourself really quickly?
Yes, sorry. I'm sorry. I thought you were talking. Yes, sorry. Hi, my name is Alma Navarrete, and I believe, one of the newest member of the DES team. I have been with DES for the last, God, it's going to be 2 months already. So, but why am I passionate about mental health? Well, as a person of color and somebody who grew up in Mexico, mental health is not something that it's not something that we really talk about. So I am really glad for this opportunity. Yeah.
Thank you, Alma. And we'll be diving a lot more into that topic. And so, as a quick, what do they call, like, what's the word I'm looking for? Housekeeping. I'm just going to go through our slide deck really quickly. So let me know if you can see this. Oh my gosh, where is my slide deck? Here we go. Can,
We only see a tiny sliver of your screen.
okay, I'm going to try this again. Okay, screen share. Okay, let's see if we can see this now. Gosh, this is, can you
I've
get,
never seen this before.
can't see
Yeah.
it? Okay, give me 1 second.
You can also send them to me and I can try.
Okay, give me
It
one
doesn't.
second. I can quickly shift while I'm working out the tech and sending this over. Um, why don't we just kind of start with Alma talking a little bit about who you are, just your full introduction.
Alrighty. So again, my name is Alma, and I have been a social worker for about 10, 12 years. Um, I am from Wenatchee, and in Wenatchee, we are agricultural in this region, so there is a lot of Spanish speaking. There's a large Spanish speaking community from different countries, Mexico, Salvador, Honduras, you name it. As a social worker, I am very passionate about promoting mental health and wellness within my community. And that is actually the reason that I pursued my master's in social work, because my goal was to provide assistance to the Spanish speaking community in their own language. As a social worker, I used to see that there was a disconnect whenever I witnessed, several clients trying to connect with uh, the providers, and I feel like it was not the same connection just because of the language barrier. So my hope was to become a therapist and help everybody. Mental health in the Hispanic community is not something that we really, talk about. There is a lot of a stigma that comes with it. When growing up, we teach our kids, especially our boys, that men don't cry. um, I recall a personal experience after my brother-in-law passed away. I noticed that my husband was very depressed, and I asked my husband to go see a therapist, and my father-in-law said, absolutely not. He's like, we don't need. There is a word in Spanish, but I can't really translate it into English. Um, and, that it meant, that we don't need that type of therapy. He said, you're a grown man, just shake it up. And, a lot of us, that's how we grow up with that stigma, that we don't, if we seek, help, then we are seen as weak. Um, what else? I now, as an employee with Washington EAP, I hope I'm able to connect with people from the Hispanic community and provide assistance and in Spanish, English, I hope not only to talk about, my goal will be to connect with family, with Spanish speaking communities on a very deep level, because I also understand the culture. And I feel like that is something that it's going to be very powerful for me when I'm working with somebody who comes from the same background as me. Jen, I think that you're up now. I can see the the slides.
Great. Thank you, everybody, for the grace of just navigating. I don't know what my computer is doing. I probably need to do one of the thousands of what is it, restarts that they prompt you to do on a daily basis, and instead I keep postponing it. But um, thank you, Alma, for that story that was so deeply moving. And I want to just hold that sentiment as we actually hold a lot of different questions. And I really invite folks to um, respond in the chat or come off mute or with reactions if any of this feels like it's striking a memory for you or a thought for you. And so I'm just going to go through the slide decks really quickly because they're very boring, but there's a few ones that I do really want to just hone in on. So, Basozi, if you would be so kind to just like next through a lot of different things, it's going to feel like I'm saying next more than I'm actually talking because a lot of this information, it's provided, it's all public.
No worries, Jen, and I'm going to be looking for your verbal cues to go into the next slide, okay?
Next slide, please. So, a little bit about EAP. We've been around for over 50 years. We have a dedicated team of a combination between paid full-time staff counseling, and then we also have a network of over 200 providers that we contract with, much to which I wanted to highlight. Over the last several years, we've really expanded our provider network to include much more. Uh, much more things that people have asked for, more providers of color, multilingual providers, just different intersectionalities that we have traditionally seen underrepresented and disenfranchised. And people have asked for it. And so, something to note, and Alma is our newest addition in our team and is both bilingual, Spanish and English. And we also have a network of over 6 providers that are Spanish speaking as well. Next slide. This is just a little bit about the stature in RCW that establishes the Employee Assistance Program into practice. Next slide. Just a little bit about why EAP works and why it's available. Okay, next slide. Typically, these are some of the primary reasons why people reach out to EAP. And what we do in our program is a largely assess and refer. And so coming to, and I'll speak to this a little bit more, but the idea is like, we like to think of ourselves as a warm handoff. If it's a short solution-based issue that we can handle within 3 sessions, then we do our best to like assess where you're at, provide resources, and if it's seemingly like a little bit longer term counseling might be more helpful, we refer you to a provider that can take you on after the first 3 sessions. We just keep it to a 3 session model because that's what we're allotted for, and and that's the investment of the employer and what they cover before we refer it on. But these are typical things that we see in EAP, much to which a large increase of our utilization came during the pandemic. And so we saw a lot of scarcity around finances, stress, parental stress particularly, and just scarcity around just the climate that we were living in. Nowadays, we see a lot of referrals around just our current state of federal executive orders, changes with leadership and management with on the statewide level and the impacts that it has on ourselves and our loved ones. Next slide. A little bit of what our services provide: short-term counseling and referrals. We do an intake process and an assessment. We are available 24 hours a day, 7 days a week, with the caveat that we are not a crisis line. So we do get people who call who are in crisis, and the term crisis management or crisis response is kind of subjective to the person. So I'll use the example of, during the holidays, we tend to see a really big uptick in or utilization in services, especially when there's like heightened stressors around the holidays. And so people might call on a Saturday on Christmas Eve and they're like, my family's driving me nuts. I just want to process and talk through. That could feel like a crisis for somebody, which is something that we absolutely can respond to. But if anybody calls us who are actively in crisis in terms of experiencing suicide thoughts or suicidality or thoughts of harming others, that's where we would refer out to either local law enforcement or crisis, referring to the crisis line, or sometimes we've been on the phone with folks and talked with them through as they walked into their local emergency department at their local hospital too. So yeah. Outside of that, too, we do a lot of organizational consultation. So we work with managers, we work with people and supervisors, and just give consulting around like how do you navigate, let's say, low staff morale, and we kind of consult with managers on like how to bring different resources and how to talk to folks and do a little bit of that coaching as well. And lastly, we have an entire department around education awareness and local libraries, webinars, and trainings. And this is where we talk a lot about, um, things like the hot topics, self-care, self-compassion, burnout prevention. We have resource libraries around just um, tip sheets on experiencing violence in the workplace, bullying, harassment, things like that. So a full network of resource libraries to take advantage of. And again, it's all free and available to you. Next slide.
Yeah, Jen, before we move on to the next slide, I don't mean to interrupt you, but we do have a question in the chat. Would you like me to read it or wait until a moment for you?
No, I can take that at the very end. I'm just going to get through this really quickly so then we can be back in a shared space seeing each other's faces rather than these slide decks with these stock images. So
Will do. Thank you, Jen.
thanks, Ms. Ozy. Next slide. This just defines a little bit of what solution focused EAP counseling is. So when we say 3 sessions, it's not 3 sessions per year or per month or per week. It's per issue. So essentially, you could be I'll just use myself as an example. Like during the pandemic, I was really struggling with working from home and just essentially keeping up with my workload and so I could speak to a counselor just about like the stressors of what it feels like to be navigating this whole work from home. And then simultaneously, I was having a lot of fear around like just what does it mean to care for aging adults and immune compromised folks in my own household because we live in a multi-generational home. So I was talking to a counselor around just like those navigating that like fear and scarcity around that. And also that referred me to then another resource, which was actually doing some will planning and estate planning. And then another 3 issues that came up was it was really difficult to be in the home with my partner all the time. So I sought a little bit of relationship counseling, which 3 sessions can be tackled for that too. So essentially, it's like you could have multiple different issues talked through with a counselor simultaneous at the same time, stretched out over a period of time. But it's 3 sessions per issue. And then from that, you meet with a counselor, they assess where you're at, see if that's something that they can support it within the 3 issues. But if it's a need for longer term, we'll refer to a counselor, hopefully in our network provider, which often, and we try to really onboard folks who accept our insurance as well. So, next slide. And this is just a little bit of the like the workflow or what you will come to expect when you reach out to EAP. You submit an intake, self-schedule an appointment, talk to a counselor, schedule for the next, and then with the counselor, they'll help you find if it's your next 3 sessions or find you a network provider that meets some of the needs that you might have or things that you have preferences for. And then you meet for your 3 sessions. And if it goes beyond that, the counselor will work with you to find something within your own network or just or the continuation of care. Next slide. we can skip through these. These are just very detailed videos that show you exactly how to fill out your forms and what to expect. So they just take a little while to watch, but you can watch them at your own time. And we can keep skipping through all this. These are just the detailed steps of what it looks like. So then it kind of takes away a little bit of the fear and the questioning of what that looks like. We have a process called formal referrals. And this is where a manager can contact EAP for a referral on behalf of an employee. That this is the process, and then the manager will talk to the employee about the referral and ask them to contact EAP so that it's like what we really strive for is a trauma-informed process so that people are in support of one another. And then the employee can decide whether they want to participate or not. So let's say you are a supervisor and you have an employee who just recently experienced a death in their family. I'm just using a case scenario, and they are really struggling and have so much going on that it's their primary mental health support isn't at the top of their mind right now, but you know that they could benefit from them. So as a manager, you can contact EAP and give us a heads up that you're going to be having a conversation with the employee and tell them that you basically let us know that this employee could benefit from. And at the end of the day, the employee still has full autonomy to decide if they want to engage or not. It's just a process and way that um, builds better supports for the employee. Okay, next slide. Okay, and this is a little bit of the areas of which our education and awareness department covers. So different things that people might ask for, and this is the things that we have available. Next slide. And just spoke a little bit about the 24/7, 7 days a week. And I'm going to actually answer the question that's in the chat because it kind of speaks to this slide. How do you unwind and not take it home? It sounds very stressful to be on the phone with somebody as they walk into crisis care. We provide a lot of supports to our team. We have a clinical supervisor, myself included, and a clinical director that really nobody, and we have a peer-to-peer partner process. So anybody who's on call, that they have somebody that they can pick up the phone and help debrief and also process any stressors of the day. In addition, for after hours and weekends and holidays, we actually contract with a third party company that are all master's level clinicians, and they basically are the after hours and weekend supports for crisis calls that come in. If it meets the threshold that they need to notify us being me or my clinical director, then they'll call us for guidance. But overwhelmingly, like we have another company that also like they do the after hour support. So it's like we're not having to shoulder all of that all the time. But how do I unwind? I try to take time throughout the day where I can. I go for walks. I tend to just step out, take deep breaths of fresh air and kind of fill my time with where I can get little places to decompress. Yeah, and having a team that's very supportive of one another is extremely helpful too. Okay, next slide. Okay, so we got through the slide deck faster than I was hoping to. So this is great. We're all on track. So if we could end the slide deck, that would be great. And some of the questions that we were hoping to pose um, to the folks who showed up today, and also just an open discussion around mental health access. Yeah, my follow-up question for you, Alma, and for anyone else who would like to chime in was, when was your earliest memory, either in Mexico or in the US, but just within your community that you noticed that mental health access was a need?
I think I was here when I moved to Washington because, to be honest with you, growing up, I do not remember ever hearing about mental health. I used to hear like my grandparents and like, like family members or older members of my community, the community that I grew up with, they used to say that they will be getting a ataque de nervios. That meant like, if somebody was having some issues. And an ataque de nervios is kind of like if you're having, like the translation is a nervous breakdown, but that's literally what I could think that they referred us to having mental health problems. And it was not until I actually got into the work field because I actually, at one point in my life, I wanted to be a nurse. So I was working as a medical assistant with a community health clinic where we would see probably 70%, if not more, of Spanish speaking populations. So I was well aware of like some of the things, that some of the patients would, say, but they would not say I am depressed or I'm having, suicidal thoughts or anything. Just like they will say other things. So, and I feel it's because of the fear of the stigma. And we know that, the HIPAA laws and everything, but that didn't come up until like what, the early 2000s. And I'm talking about like mid 90s. So, yeah. Yep. Ermina put a question in the chat, and that is so true. She said she doesn't remember ever hearing about mental health services outside institutionalized assistance. Yep, that's exactly my experience too, when I was growing up. What else?
Yeah, I can relate to that as well. It was mental health. So anytime if there was issues, it would be like talk to your local priest in our community, or I think about my earliest memories. My grandmother in Vietnam was an exorcist, which as in like a child, you're like, wow, I don't totally know what that means. But even as a teenager, I remember thinking like, an exorcist? Okay, that's interesting. And, like hearing her stories and describing it, I realized that much to which they were describing sounds like somebody who was either in crisis or had an undiagnosed mental health disorder like schizophrenia or bipolar. And I just remember thinking like, oh my gosh, like while, her profession in Vietnam was considered to be very noble because of like the place it holds in the church and just the notion of like ridding the evil from somebody's body, I just remember thinking like, oh, that's not at all what was going on there, like at all. And so it's interesting our earliest memories and how it is treated.